lymphoma, it's a cancer in the lymphoid, okay, lymphoid tissue. What are lymphoid? You just know the lymph nodes, okay? Your spleen is part of it. Your thymus is in your neck, okay? It's part of it. And your bone marrow, there's lymph tissue there. So these are places where you can get lymphoma from, right? So this is a very classic is a lymphoid tissue cancer, basically. How would there's a way we've divided into two. There's a Hodgkin's. I think that's what confused people. Forget about the name. Some guy named Hodgkin's versus non-Hodgkin's lymphoma. Right? Or is the difference between them is some cells we're looking for and then how it's transferred, right? The Hodgkin's is very uniform. You know where the cancer is going to go. So Hodgkin's, and if it's spreading, it's uniform and it's predictable. I know that when it moves from the spleen, it goes to here. So you can know the spread. It spread from the node tissue to another organ. Specifically, you know what is going to happen. In the non-Hodgkin's, you can determine the pathway. So the spread is not uniform. It can go anywhere you want. You can't determine it. That is the difference. If you see a question like that, it's irrelevant. It's just telling you this one is non-orderly spreading. It's not non-orderly spreading. That's all. Then another difference is non-Hodgkin's is common in older patients, and Hodgkin's is usually kids, so like children and teenagers. So that's the only two differences between them. Remember, lymphoma is more common in men than female, in case they ask you. But this what they like asking you is this: B symptoms. And it's the same thing, non-specific. We call it B symptoms. They have low-grade fever or night sweats. It's like if every time you hear about lymphoma, think about TB. Connect the symptoms of patient who has TB to that of lymphoma. It's the same. Okay, low-grade night fever or night sweats, right? Number one. Then the weight loss unintentionally. They lose weight is not intended. They don't intend to lose weight, but they're losing weight. So unintentional weight loss, right? And then they will have fatigue. These are all big symptoms. And then they will have pruritus. The skin itches a lot. These are non-specific symptoms. And then they will have enlarged lymph node, but enlarged lymph node is not part of the B symptoms. So these are the B symptoms: night sweats, weight loss, fatigue, pruritus. If they give you a case for lymphoma, it will be like this. It's the same thing. If they give you a case for TB, it will also look like that. Does it tell you what it is? No, you don't know. But they will have enlarged lymph node. Yeah, you can feel palpable lymph nodes. Yeah, that gives you a clue. How do you diagnose it? Just biopsy. So you biopsy the lymph node and you send it for biopsy. And then they're looking for some cells in it and to make the diagnosis. That's all. And so this is the cell that, in case you see in a multiple choice, is red Stenberg. Some guy's name, like I say all the time. That's all. When you see that, oh, they know that this is a lymphoma. It's not because they have cold. In TB, they will see non-caseous granuloma. That is different. For TB, they will give you like a caseation granuloma. So that's the way you can distinguish between. This is TV, but in this one, lymph node, you see red stem big cells, right? Then you make the diagnosis. That's lymphoma, right? That's lymphoma right there. How do you treat it? You don't have to look further. You know that. You mean like the hallmark symptoms for lymphoma? Yeah, the hallmark symptoms for lymphoma is B symptoms plus palpable lymph nodes. So that's what I mean. Night sweats, weight loss, unintentional, fever, fatigue, pruritus. These are hallmark, but you have to have B symptoms plus lymph node. Okay, so what do? You biopsy it, and then you make a diagnosis. How do you treat them? Chemotherapy and radiation, right? They get chemotherapy for a long time, radiation. What I want you to know is don't worry too much about chemo drugs. The chemo they use is CHOP, cyclophosphamide, doxorubicin. I mean, you don't have to know. That's the name of the medication. I know when you're in nursing school, you have to know, but I don't think they will ask you. But that's the name of it, the CHOP. And it has SRT is radiation, basically. What I want you to pay attention to is this. When they're getting chemo, you should expect them to get sick, right? Chemotherapy. Well, how did they get sick? They become Pancytopenia. What does that mean? That means their platelet is low, your RBC is low, and your WBC is low. That's Pancytopenia. If they give you a case, what do you want to do? Treat this patient. What medication you give? You know that. I mean, I talk about them all the time. It's simple hematology. If you don't know any pharmacology about hematology, you got to know these three drugs. I got to increase their platelets. I got to increase their RBC, and I got to increase their WBC. And somebody help me out there. You guys know that. So these three medications, you got to be able to record them easily, right? So the treatment to increase their platelets, I remember Oprah. If you don't remember Oprah to increase, you prevent you from bleeding. That's Oprelvekin, right? And what is the side effect? Fluid overload. Okay, and you can get a cardiac arrhythmia too from that. So that's the first medication. What medication you give them when their platelet, their RBC is low? So RBC, what medication you give them? What is the name of it? Epoetin, right? And what is the main side effect? Polycythemic or hypertension is number one. Why? Because when you give them EPO, RBC goes up, their hematocrit goes up, their blood volume goes up. And what happens? They have polycythemia vera. You don't want them to get to this place. By the time the blood volume go up, they go into stroke. And so this is hypertension. As soon as you see hypertension in somebody that you give them Epoetin, you should stop the medication because they're about to stroke. How about WBC? What medication you give them? I call them the Grastim. Their last name is Grastim. You don't have to even remember their first name, but the common one is Filgrastim. And this is going to increase your WBC. And if you increase your WBC, it will help in that. The common side effect is bone pain. This is pharmacology for hematology. These three medications you have to know. So that's what the chemotherapy medication they will get. Simple. And you have to, what do you need to tell this patient? I'm giving you all the things they can give you. Neutropenic precaution. Neutropenic precaution. This is like everything they can ask you. And what is that? You know them, right? Don't go around in the crowd. Stay away from them, right? If you have cat doo-doo, don't clean it. Okay, you can have cats, but don't go near doo-doos, the poops, right? Poop, stay away from it. You can't eat fresh vegetables, right? You can't go to the hot dog stand and eat over there. Don't avoid that. You can't drink from water fountain. All this thing is like, I don't have to tell you. You should be able to, if you see it in a SATA question, you don't have to memorize. You can make it up. You say, okay, I'm going to get sick. Therefore, all these things, water fountain, outdoor, fresh vegetables. I can't go near, I can't travel. I mean, I can go, but it has to be small place. I can't go to the park. People will make me sick. You got to wear certain masks. All those things, it just can't, it makes sense. Neutropenic precaution, right? And if they're getting radiation, then you do the same thing. You're going to get chemo radiation. Radiation too, there's a certain things you tell them, and you have to know this specifically. They'll put markers on their skin where they put the radiation. Tell them to leave the marker alone. Don't touch it. Okay, and don't put no cream that area, no special cream, no lotion, no deodorant, never. Don't put it there. Okay, how did they wash themselves? Lukewarm water at the area where the radiation goes is fine, and they should assess the area for redness. Okay, you're going to have nausea, take care of it. Okay, and you tell them avoid the sun, don't go near the sun, avoid hot water, otherwise you burn the skin. And the one that is very important is cotton. They have to wear cotton clothes. It's good. It prevents irritation of the dark skin. And this is radiation precautions. And then chemotherapy is neutropenic. Remember, this is a trap, okay? Radiation is not systemic. So they don't get all these neutropenic, your white cell don't go down, your platelet, because it's not affecting your bone marrow. If I have cancer here, radiation is coming straight here and kick the cancer here. It doesn't go to my liver. It doesn't go to my blood. So this is localized effect. So all the systemic effect from chemotherapy never happen. Chemotherapy, you go to your blood, you go into your heart, you go everywhere. Every organ is in trouble. That's why they have diarrhea, mucositis. They get weak. They have bone marrow problem. They have like basically everything. So just look at the answer choice. If I put systemic manifestation for radiation, I will not choose the answer unless they frame it differently. Okay. You wear cotton wear, it's okay. Okay, so then what you have to know after all this, you got to know what will happen when you give them chemotherapy. Okay, now just make it straight. This is the cancer cell. Okay, potassium is more inside the cell, phosphorus more inside the cell, and your DNA is more inside the cell. I give you chemotherapy. What do you think? It's going to destroy this cell, and these cells burst open. And then guess what? Potassium goes high, DNA goes high. This is uric acid. Phosphorus go high in your blood. Now I'm in your blood. Your calcium goes down because the phosphorus bind to it. What is this? Expect this kind of question, hematology question can come. What do you think this is? What do you think this is? I come in, I have lymphoma, and you slam me with chemotherapy. All of a sudden, boom, my potassium is high. I have cardiac arrhythmia. I have kidney stone. My urine output is low. My phosphorus is high. I have tetany. I have low calcium. All the symptoms of hypocalcemia. What are you dealing? Tumor lysis syndrome. Excellent. You know, I said my boys are good. Yes. Tumor lysis syndrome. And then you can treat it. You know what to do, right? The potassium is high. What do you think they will show? Cardiac arrhythmia. Okay, uric acid is high. It will block the kidney. They have renal failure. Phosphorus will bind to the calcium. It forms a stone, renal failure. If your calcium is low, you know what will happen. You have seizures, right? You have the C sign and T sign. I'm not going to list it, but you know what it is, right? What is the C sign and T sign? Hypocalcemia. What is that? T sign and C sign. My calcium is low. I will start having T and C sign. What is that? What do you think? Yes. Chelsea sign and Clouseau signs. Expect that to happen. So if I give you a question and then I start looking at saying that you're going to have seizures and all those things, yes, that is what it is. That is this. So, and therefore, how do you treat tumor lysis syndrome? Easy, right? How do you treat it? You know how to treat potassium, I told you, right? So give them some glucose, give them some insulin to drive it up, give them some furosemide to take care of it. You know how to treat hypocalcemia, right? Give them calcium, right? Or get rid of the potassium, the phosphorus. Find something that will bind the phosphorus, phosphate binder. How do you treat the DNA? What do you do? What do you guys think? How do you treat the DNA, the uric acid? What do you give them? What do you give for the uric acid? Yeah, allopurinol. So you know the answer. I don't even have to give it to you. So we give the patient allo. So when you see a case study, you should be able to ace it, right? So allopurinol. That's the treatment. And you give them a bunch of fluid and he's taking care of it. So hematology questions should not be that hard for you based on your answers. Okay. Okay. Any questions? And that's what you should like. You start thinking when you go through this process, and as you study, you should be able to dive in. Don't limit yourself. But this is a simple lymphoma, but it's the same thing as leukemia. Whatever you know for leukemia, take it. The only thing is you have to know the B symptoms: weight loss, unintentional pruritus, and night sweats, chills. Like, but if you know TB, yeah, you know lymphoma. That's the same symptoms they're going to have. They're going to have the same symptoms of TB. You just have to biopsy it. If they tell you it's Hodgkin, non-Hodgkin lymphoma, they want you to distinguish between them. Hodgkin, I know when it's going to go a certain place. Non-Hodgkin, I don't know. But the rest of it is the same thing. It's immunocompromised patient. They get chemotherapy and radiation. You have to teach them about chemo. You have to teach them about radiation and what they look for. And then we take care of it. You never treat this forever. You go in remission. And so you have to take care of them. Any question? That's lymphoma for right there. Sorry, my diagram is like all over the place. Any question on this? But I try to use the diagram so that you can think. It's a visual. You can see like, oh, okay, there's branches. Medicine is interconnected. You see how you bring your pharmacology to your pathophysiology, and you know your electrolyte. So Like they're not going to get lost. Wherever you see hypocalcemia,